Question 1. Scenario-based question. Mr. Muller, 50-year-old male, presents to the emergency department following car accident. He is conscious but complains of severe chest pain and difficulty breathing. Chest x-rays ordered, revealing fractured rib and potential lung contusion. The radiologist must decide whether additional imaging is necessary to confirm the extent of the injury. Given the patient's clinical condition, which imaging technique would be most appropriate for assessing the possible lung injury in this case? MRI, due to its superior soft tissue contrast and ability to detect lung contusions. B. Ultrasound, as it is the quickest option and can evaluate the thoracic structures in trauma cases. C. CT scan, as it provides detailed images of both bone and soft tissue, particularly useful for trauma evaluation. D. X-ray, as it is the only imaging modality needed to evaluate chest trauma in this case. Answer. C. Explanation. In trauma cases, especially with chest injury, CT scans are highly preferred because they offer more detailed imaging of both bone fractures and soft tissues, including the lungs, which is critical in evaluating potential injuries like lung contusions or pneumothorax. Chest X-rays are often the first-line imaging modality but may not reveal the full extent of injury, especially for soft tissue damage. MRI is not ideal for initial trauma imaging due to its longer acquisition time, and ultrasound can be useful for detecting fluid, but it doesn't provide the resolution required for accurate bone and soft tissue evaluation in this context. Question 2. Which of the following is a primary principle of radiation protection that ensures the dose to patients is kept as low as reasonably achievable, minimizing the risk of unnecessary exposure? A. Alara, as low as reasonably achievable. B. The 10-day rule for pelvic imaging in women of childbearing age. C. The inverse square law of radiation dose reduction. D. The principle of informed consent for imaging procedures. Answer. A. Explanation. The principle of Alara, as low as reasonably achievable, is fundamental in radiation protection. It is a key concept in radiology that emphasizes minimizing radiation exposure to patients while ensuring that diagnostic image quality is still maintained. This principle is applied to both occupational and patient exposures, while the 10-day rule is a guideline to limit radiation exposure during certain phases of woman's menstrual cycle. Alara is the broader principle applied universally across all types of imaging to reduce unnecessary exposure. The inverse square law describes the decrease in radiation intensity with distance, but isn't directly protection measure like Alara. Informed consent is important for patient autonomy, but is not directly related to minimizing radiation exposure. Question 3. Which of the following is a key factor that determines the effectiveness of a radiation protection shield in reducing exposure during fluoroscopy procedures? A. The type of material the shield is made from. G. Lead or barium. B. The patient's body size and shape. C. The length of time the fluoroscopic procedure lasts. D. The radiation dose rate at the source. Answer. A. Explanation. The material of the shield is one of the primary factors influencing its effectiveness. Lead is the most commonly used material for radiation protection because of its high atomic number, which effectively absorbs X-rays and reduces the exposure to both patients and radiologists. The patient's body size and shape can affect the scatter radiation received, but it is the shielding material that directly reduces exposure. Duration does influence overall exposure, but is secondary to the material properties of the shield. The radiation dose rate at the source is relevant, but without proper shielding, even a low dose rate can lead to unnecessary exposure. Question 4. Scenario-based question. Mr. Schmidt, a 45-year-old male with a history of smoking, presents with severe shortness of breath and a cough lasting for several weeks. A chest X-ray is performed, showing an irregular mass in the right lung. The radiologist is concerned that this could be a lung tumor. What imaging technique should the radiologist recommend next to confirm the diagnosis and assess the size and location of the mass? A. CT scan of the chest, as it provides detailed images of lung tissue and masses. A MRI to better visualize soft tissue characteristics of the tumor. C. Ultrasound to check for fluid accumulation around the lung. D. PET scan, as it can help assess the metabolic activity of the mass. Answer. A. Explanation. Acne of the chest is the next appropriate imaging technique when a mass is detected on a chest X-ray. It provides more detailed cross-sectional images of the lungs and surrounding tissues, helping to assess the size, location, and characteristics of the mass. MRI is not typically used for lung tissue evaluation because it does not offer as clear visualization of lung parenchyma as CT. Ultrasound can be used to detect pleural effusion, but is not effective in visualizing lung masses. PET scans can be helpful for evaluating the metabolic activity of a mass, but ECN should be performed first to assess the tumor's anatomy and guide further diagnostic steps. Question 5. Which of the following radiation protection practices should be followed to minimize the exposure of a pregnant patient during an X-ray procedure? A. Postpone the procedure unless it is absolutely medically necessary. B. Use a lower dose technique for the X-ray. C. Position a lead apron over the abdominal area of the patient. D. Perform the procedure only during the first trimester to minimize risks. Answer A. Explanation. The most effective approach is to postpone the procedure unless it is medically essential. While using a lead apron, option C can help reduce exposure to the abdomen. It is not as effective as determining whether the procedure is necessary. If the procedure is necessary, a lower dose technique, option B, can be applied. However, it is generally advised to limit any imaging during pregnancy unless absolutely required. Perform imaging should be based on the principle of minimizing risk, and the first trimester, option D, carries the highest risk for fetal development, so imaging should be avoided during this period unless medically necessary. Question 6. Which of the following is the most important factor when selecting the appropriate imaging modality for a patient with suspected neurological disease? A. The patient's medical history and symptoms. B. The type of equipment available in the radiology department. C. The potential radiation dose to the patient. D. The cost-effectiveness of the imaging procedure. Answer A. Explanation. The most important factor in selecting the appropriate imaging modality is the patient's medical history and symptoms. A thorough clinical evaluation, including symptoms such as headaches, visual disturbances, or weakness, will guide the choice of imaging technique. For example, MRI is often preferred for neurological conditions due to its superior soft tissue contrast, while CT may be used for acute conditions like trauma. Radiation dose, option C, and cost effectiveness, option D, are secondary considerations but do not take precedence over the clinical indications. The availability of equipment, option B, is important but should not override the clinical needs of the patient. Question 7. Scenario-based question. Dr. Weber is performing an abdominal CT scan on a 70-year-old patient who has a history of kidney disease. The patient requires contrast-enhanced imaging to evaluate for possible gastrointestinal bleeding. The radiologist is concerned about the potential for contrast-induced nephropathy, SIN. What precautions should be taken before administering contrast media? A. Prehydrate the patient with intravenous fluids to protect the kidneys. B. Limit the contrast volume and administer it slowly to minimize kidney exposure. C. Perform the procedure without contrast media and rely on non-contrast CT imaging. D. Administer a low osmolar contrast agent to reduce the risk of SIN. Answer A. Explanation. Prehydrating the patient with intravenous fluids is the most effective precaution to reduce the risk of contrast-induced nephropathy. SIN hydration helps flush the contrast agent from the kidneys and improves renal perfusion. Limiting the contrast volume, option B, and administering it slowly can help, but prehydration is the most critical measure for preventing SIN. Non-contrast CT, option C, may not provide necessary diagnostic information, especially in suspected gastrointestinal bleeding. Low osmolar contrast agents, option D, can be used to reduce the risk of SIN, but adequate hydration remains the most effective preventive strategy. Question 8. Which of the following is true regarding the biological effects of ionizing radiation on human cells? A. Ionizing radiation causes direct DNA damage through interactions with cell proteins. B. Ionizing radiation cannot cause mutations or cancer in human cells. C. The effects of ionizing radiation are always immediate and evident. D. Ionizing radiation causes both direct and indirect damage, including the formation of free radicals. Answer D. Explanation. Ionizing radiation causes both direct and indirect damage. Direct damage occurs when radiation directly interacts with cellular DNA, leading to breaks or mutations. Indirect damage occurs when radiation interacts with water molecules, generating free radicals that can later cause DNA damage. These processes are not always immediate but can lead to long-term effects such as cancer or genetic mutations. The statement that ionizing radiation cannot cause mutations or cancer is incorrect, as these are well-documented risks of exposure. Additionally, the effects are not always immediately visible and take years to manifest. Question 9. In the context of radiology, what is the primary purpose of using digital radiography, doctor, over computed radiography, CR? A. Doctor has faster image acquisition times and requires less maintenance than CR. B. Doctor provides higher image resolution, making it more accurate for diagnostic purposes. C. Doctor uses less radiation, making it safer for patients than CR. D. Doctor is cheaper to implement and maintain compared to CR. Answer A. Explanation. Digital radiography, doctor, has faster image acquisition times and requires less maintenance than computed radiography, CR. Doctor systems use flat panel detectors that capture images directly, leading to faster processing and reduced need for physical imaging plates. While both doctor and CR provide high-quality images, doctor systems are generally more efficient, both in terms of speed and maintenance. Resolution, option B, is not a primary differentiator between doctor and CR. Both systems can achieve similar resolution depending on the technology used. Radiation dose, option C, can vary depending on the technique and system, but the advantage of doctor lies more in efficiency rather than safety. Cost, option D, is often higher for doctor, not lower. Question 10. Which imaging modality is most suitable for evaluating soft tissue injuries such as ligament tears, cartilage damage, or muscle strain? A. X-ray, as it provides clear images of soft tissue damage. B. CT, as it can clearly visualize soft tissue structures. C. MRI, due to its excellent contrast for soft tissues. D. Ultrasound, as it is the best modality for detecting soft tissue tears. Answer C. Explanation. MRI is the most suitable modality for evaluating soft tissue injuries. It provides excellent contrast for soft tissues like ligaments, cartilage, and muscles, making it the best choice for diagnosing tears, strains, and other soft tissue injuries. X-ray, option A, is primarily used for bone fractures and does not offer clear imaging of soft tissue structures. CT, option B, can visualize soft tissue to some extent, but it is better for bone-related injuries and not as effective as MRI for soft tissue assessment. Ultrasound, option D, is useful for real-time imaging of certain soft tissues, but lacks the detailed resolution provided MRI for diagnosing deeper soft tissue injuries. Question 11. Scenario-based question. A 25-year-old woman presents with abdominal pain and a palpable mass in the right lower quadrant. A key is ordered, revealing a 5 cm mass, and there is concern about the possibility of ovarian cancer. What imaging modality is most appropriate for evaluating the nature of the mass and determining whether it is benign or malignant? A. Ultrasound, as it is the first-line imaging technique for ovarian masses. B. MRI, to provide better tissue characterization of the mass. C. PET scan, to evaluate for metastases. D. CT with contrast, as it provides detailed information about the mass's characteristics. Answer A. Explanation. Ultrasound is the first-line imaging modality for evaluating ovarian masses. It is a non-invasive, cost-effective, and widely available tool that helps distinguish between benign and malignant masses based on characteristics like size, shape, and cystic or solid components. MRI, option B, can be used for further characterization, but ultrasound should be the first step. PET scan, option C, is more commonly used for assessing metastases rather than evaluating primary ovarian masses. CT with contrast, option D, may be used in certain situations, but it is less effective for soft tissue differentiation compared to ultrasound or MRI. Question 12. Which of the following best describes the principle of ALARA in the context of radiation protection in radiology? A. Radiation exposure should be kept as low as reasonably achievable to minimize harm to patients and staff. B. Radiation exposure should be kept high to ensure that diagnostic images are of sufficient quality. C. Radiation exposure should be limited to the first trimester of pregnancy to prevent birth defects. D. Radiation exposure is irrelevant as long as diagnostic imaging is performed. Answer A. Explanation. The principle of ALARA, as low as reasonably achievable, emphasizes that radiation exposure should be minimized to the lowest level necessary to obtain diagnostic information in order to reduce potential harm to both patients and healthcare workers. This principle applies to all forms of radiation use, ensuring that patient safety is prioritized. Options B, C, and D are incorrect because ELIRA specifically focuses on minimizing exposure rather than ensuring high radiation doses or ignoring risks entirely. Question 13. Which of the following imaging techniques is most commonly used for evaluating suspected stroke in an emergency setting? MRI, due to its superior ability to detect acute ischemic changes. B. CT scan, as it is faster and more widely available in emergency departments. C. Ultrasound, for detecting blockages in the carotid arteries. D. PET scan, for assessing brain activity and function. Answer B. Explanation. CT scan is the most commonly used imaging modality for evaluating suspected strokes in the emergency setting. It is fast, widely available, and effective in ruling out hemorrhagic strokes, e.g. brain bleeds, while MRI option A is more sensitive for detecting ischemic changes in the brain. It is not as fast or accessible as CT in the acute setting. Ultrasound option C is used to evaluate carotid artery stenosis but is not effective for detecting strokes themselves. PET scans, option D, are typically used in research or for assessing brain function but are not used in the emergency evaluation of stroke. Question 14. Which of the following statements is true regarding the use of contrast agents in radiology? A. Contrast agents always carry a risk of allergic reaction which can range from mild to severe. B. Contrast agents should never be used in patients with kidney disease as they can cause irreversible damage. C. Contrast agents are used to enhance the visibility of blood vessels, bones, and soft tissues during imaging. D. Contrast agents are effective only in CT scans, not MRI or X-ray imaging. Answer A. Explanation. Contrast agents can cause allergic reactions, which range from mild, e.g. nausea, hives, to severe, e.g. anaphylaxis. This risk is why it is important to carefully screen patients for allergies or previous reactions to contrast agents. Option B is incorrect because contrast agents can be used with caution in patients with kidney disease, but their use requires careful monitoring to prevent contrast-induced nephropathy. Option C is partially correct in that contrast agents are used to enhance the visibility of blood vessels and soft tissues, but they are not typically used to visualize bones. X-rays or CT can do that without contrast. Option D is incorrect because contrast agents are used in both MRI and ET scans for enhancing imaging, not limited to so. Question 15. Which of the following is a key advantage of magnetic resonance imaging MRI over other imaging modalities like CT and X-ray? MRI uses ionizing radiation, which is useful for diagnosing certain conditions. MRI provides superior soft tissue contrast, making it ideal for evaluating the brain, spinal cord, and joints. MRI is more cost-effective and faster than CT and X-ray. MRI is less sensitive to movement artifacts, which makes it ideal for imaging pediatric patients. Answer B. Explanation. MRI provides superior soft tissue contrast, making it the modality of choice for evaluating structures such as the brain, spinal cord, and joints. This is a key advantage over CT and X-ray, which are less effective at distinguishing between different soft tissues. Option A is incorrect because MRI does not use ionizing radiation, unlike CT and X-ray. Option C is incorrect as MRI is generally more expensive and slower than CT and X-ray. Option D is incorrect because MRI is more sensitive to movement artifacts, and thus it can be challenging to obtain high-quality images in pediatric patients without sedation. Question 16. A 55-year-old male presents with a persistent cough, weight loss, and night sweats. A chest X-ray reveals a large mass in the right upper lung. What is the most likely next step in the diagnostic workup for this patient? A. Sputum culture for tuberculosis. B. Pulmonary function testing to assess lung capacity. C. Bronchoscopy with biopsy to obtain tissue for histological evaluation. D. CT scan of the abdomen to evaluate for metastatic disease. Answer C. Explanation. Given the patient's symptoms and chest X-ray findings, the most likely diagnosis is a lung tumor. Bronchoscopy with biopsy is the most appropriate next step to obtain tissue for histological evaluation and to confirm the diagnosis of lung cancer or other lung pathology. Sputum culture option A is useful for detecting tuberculosis, but it is less appropriate when there is concern for malignancy. Pulmonary function testing option B is typically used to assess lung function, but it does not aid in the diagnosis of a mass. CT scan of the abdomen option D would be useful if there is suspicion of metastases after confirming the diagnosis, but the priority is tissue diagnosis. Question 17. Which of the following is the most common cause of community-acquired pneumonia in adults? A. Streptococcus pneumoniae, B. Mycoplasma pneumoniae, C. Haemophilus influenzae, D. Influenza virus. Answer A. Explanation. The most common cause of community-acquired pneumonia in adults is Streptococcus pneumoniae, a gram-positive bacterium. It is responsible for a significant proportion of bacterial pneumonia cases. Mycoplasma pneumoniae, option B, is although a common cause of pneumonia, particularly in younger individuals, but it is less common than Streptococcus pneumoniae. Haemophilus influenzae, option C, pneumonia, especially in individuals with chronic conditions like COT, but it is not as common as Streptococcus pneumoniae. Influenza virus, option D, can cause pneumonia, but it is more associated with viral infections and not the most common cause of bacterial pneumonia. Question 18. A 40-year-old woman presents with severe, sharp chest pain that worsens with deep inspiration. She has a history of lupus and is currently on immunosuppressive therapy. What is the most likely cause of her chest pain? A. Pulmonary embolism, B. Acute pericarditis, C. Pneumothorax, D. Costochondritis. Answer B. Explanation. Given the patient's history of lupus and immunosuppressive therapy, the most likely cause of her chest pain is acute pericarditis, known complication of lupus. This condition can cause sharp chest pain that worsens with deep inspiration or coughing. Pulmonary embolism, option A, can also cause sharp chest pain, but it is often associated with other risk factors such as deep vein thrombosis and would likely present more systemic symptoms, e.g., dyspnea, hypoxia. Pneumothorax, option C, typically presents with sudden onset of chest pain and difficulty breathing, but there is no mention of trauma or spontaneous pneumothorax risk factors. Costochondritis, option D, can cause localized chest pain, but it is less likely in this patient with lupus. Question 19. Which of the following imaging modalities is preferred for evaluating acute appendicitis in a pregnant woman? A. CT scan with contrast, B. Abdominal ultrasound, C. MRI with contrast, D. X-ray of the abdomen. Answer B. Explanation. Abdominal ultrasound is the preferred imaging modality for evaluating acute appendicitis in a pregnant woman because it avoids the use of ionizing radiation, which could be harmful to the fetus. CT scan with contrast, option A, is typically avoided during pregnancy unless absolutely necessary due to the risks associated with radiation exposure. MRI with contrast, option C, may be used in some cases if ultrasound is inconclusive, but it is generally not the first choice due to cost and availability. X-ray of the abdomen, option D, is not typically used for diagnosing appendicitis as it provides limited information about soft tissue structures. Question 20. A 25-year-old male presents with a painful, swollen left knee following a sports injury. The knee shows significant effusion and tenderness over the joint line. What is the most appropriate next step in the management of this patient? A. Immediate surgical consultation for knee arthroscopy, B. MRI of the knee to evaluate for meniscal or ligamentous injury, C. X-ray of the knee to rule out fractures, D. Application of ice and rest for conservative management. Answer C. Explanation. X-ray of the knee is the most appropriate next step in this patient's management to rule out fractures, especially given the mechanism of injury and the presence of effusion. It is important to assess for bony injuries before proceeding with further imaging or interventions. MRI, option B, is typically used to assess soft tissue structures like the meniscus or ligaments, but is not the first-line imaging modality after an acute injury unless there are signs of significant ligamentous damage. Knee arthroscopy, option A, is not indicated immediately unless there is clear indication of surgical emergency such as knee dislocation or irreducible joint injury. Application of ice and rest, option D, is important for conservative management but does not replace the need for diagnostic imaging when significant injury is suspected. Question 21. A 70-year-old man with a history of smoking presents with a persistent cough, hemoptysis, and weight loss. A chest X-ray shows a spiculated mass in the right lung. What is the most likely diagnosis? A. Lung cancer, B. Tuberculosis, C. Pulmonary embolism, D. Pneumonia. Answer A. Explanation. given the patient's smoking history and the chest X-ray findings of a spiculated mass lung cancer is the most likely diagnosis. Smoking is a significant risk factor for lung cancer, and the presence of hemoptysis and weight loss further supports this. Tuberculosis, option B, can present with similar symptoms but is less likely to cause a spiculated mass on imaging. Pulmonary embolism, option C, typically with sudden onset chest pain, dyspnea, and sometimes hemoptysis but not with a mass on imaging. Pneumonia, option D, may cause cough and sometimes hemoptysis but is usually associated with a more diffuse infiltrate on X-ray rather than a localized mass. Question 22. A 55-year-old woman with a history of hypertension presents with acute onset of severe tearing chest pain radiating to her back. Her blood pressure is 210 on 120 millimeters Hg. What is the most likely diagnosis? A. Acute myocardial infarction. B. Aortic dissection. C. Pulmonary embolism. D. Acute pericarditis. Answer. B. Explanation. The patient's symptoms of severe tearing chest pain radiating to the back, along with history of hypertension, are highly suggestive of an aortic dissection. This condition often presents with chest pain described as tearing or ripping, and it is associated with uncontrolled hypertension. Acute myocardial infarction, option A, can cause chest pain, but is usually associated with other findings like scintillation on egg. Pulmonary embolism, option C, typically presents with sudden onset chest pain and dyspnea, but it does not usually cause tearing pain or radiate to the back. Acute pericarditis, option D, can cause chest pain, but it is typically pleuritic in nature and worsens with inspiration, not with the sudden onset and radiating pattern seen in this patient. Question 23. A 30-year-old man presents with painful swelling in his left ankle after a sprain. He is unable to bear weight on the affected leg. What is the most appropriate initial diagnostic step? A. X-ray of the ankle. B. MRI of the ankle. C. CT scan of the ankle. D. Ultrasound of the ankle. Answer. A. Explanation. The X-ray of the ankle is the most appropriate initial diagnostic step for a suspected ankle sprain to rule out fractures. An X-ray is typically the first imaging modality used to evaluate bony injuries. MRI, option B, may be indicated if there is concern for ligamentous or soft tissue injuries after the X-ray. However, it is not the first choice unless the diagnosis remains unclear. CT scan, option C, is not commonly used for initial ankle sprain evaluation unless there is suspicion of complex fractures. Ultrasound, option D, is useful for evaluating soft tissue injuries, but is not typically used first in ankle sprains. Question 24. A 45-year-old woman presents with a butterfly-shaped rash on her face, along with joint pain and photosensitivity. She is diagnosed with systemic lupus erythematosus. SLE. What is the most appropriate test to confirm the diagnosis? A. Anti-SDNA. B. Antinuclear antibody on a. C. Rheumatoid factor. RF. D. C-reactive protein. Answer. B. Explanation. Antinuclear antibody (ONA) is the most appropriate test to confirm the diagnosis of systemic lupus erythematosus (SLE). ONA is positive in the vast majority of patients with SLE, though it is not specific and can be positive in other autoimmune diseases. Anti-SDNA, option A, is a more specific antibody test for SLE, but is not typically used as a screening test. Rheumatoid factor, option C, is used to diagnose rheumatoid arthritis, not SLE. C-reactive protein, option D, is an inflammatory marker, but is not specific to SLE and would not used to confirm the diagnosis. Question 25. A 60-year-old man with diabetes presents with progressive numbness and tingling in his feet, along with a history of poor blood sugar control. What is the most likely diagnosis? A. Diabetic neuropathy. B. Peripheral artery disease. C. Multiple sclerosis. D. Guillain-Barré syndrome. Answer. A. Explanation. The most likely diagnosis is diabetic neuropathy, a common complication of long-standing diabetes. It typically presents with numbness, tingling, and loss of sensation in the distal extremities, particularly the feet, and is associated with poor blood sugar control. Peripheral artery disease, option B, can cause leg pain, especially with exertion, but it is less likely to present with numbness and tingling. Multiple sclerosis, C, is a central nervous system disorder that can cause sensory symptoms but would usually affect other areas of the body in addition to the feet. Guillain-Barré syndrome, option D, is an acute condition that typically causes ascending muscle weakness, not just numbness and tingling in the feet. Question 26. A 45-year-old man presents with a history of recurrent episodes of palpitations, sweating, and anxiety. His blood pressure is 180 to 100 millimeters Hg and his pulse is 120 bpm. What is the most likely diagnosis? A. Panic disorder. B. Hypothyroidism. C. Pheochromocytoma. D. Atrial fibrillation. Answer C. Explanation. Pheochromocytoma is the most likely diagnosis. This condition involves a tumor of the adrenal glands that secretes catecholamines, leading to episodes of palpitations, sweating, anxiety, and elevated blood pressure. The patient's symptoms, including intermittent hypertension and palpitations, suggest this diagnosis. Panic disorder, option A, can cause anxiety and palpitations, but it does not typically result in persistent blood pressure. Hypothyroidism, option B, can cause palpitations, anxiety, and tachycardia, but it is typically accompanied by other signs like weight loss and heat intolerance. Atrial fibrillation, option D, may cause palpitations and tachycardia, but it would not explain the episodic nature of symptoms or the significant increase in blood pressure. Question 27. A 22-year-old woman presents with irregular menstrual cycles, hirsutism, and acne. On examination, she has a BR of 30 and her blood pressure is normal. What is the most likely diagnosis? A. Polycystic ovary syndrome, PCOS. B. Hypothyroidism. C. Cushing's syndrome. D. Endometriosis. Answer A. Explanation. Polycystic ovary syndrome, PCOS, is the most likely diagnosis. PCOS is characterized by irregular menstrual cycles, hirsutism, acne, and obesity as seen in this patient. The condition is also associated with hormonal imbalances such as elevated androgens, which contribute to the physical symptoms. Hypothyroidism, option B, can cause menstrual irregularities, but it typically presents with others like fatigue, weight gain, and cold intolerance, which this patient does not have. Cushing's syndrome, option C, can cause hirsutism, but it is usually accompanied by other features such as weight gain, central obesity, and a moon face. Endometriosis, option D, typically presents with painful periods and infertility rather than hirsutism and acne. Question 28. A 60-year-old woman with a history of smoking presents with sudden onset severe chest pain, dyspnea, and a feeling of impending doom. Her heart rate is 110 bpm and her oxygen saturation is 89%. What is the most likely diagnosis? A. Pulmonary embolism. B. Acute myocardial infarction. C. Aortic dissection. D. Pneumothorax. Answer A. Explanation. The presentation of sudden onset severe chest pain, dyspnea, impending doom, and low oxygen saturation suggests pulmonary embolism. P. Risk factors such as smoking increase the likelihood of P. The condition presents with acute symptoms due to a blockage in the pulmonary arteries leading to impaired oxygenation and dyspnea. Acute myocardial infarction, option B, typically presents with chest pain and radiate to the arm or jaw, but it is less likely to cause the low oxygen saturation and acute dyspnea seen here. Aortic dissection, option C, can present with severe chest pain, but usually with radiation to the back and is associated with hypertension. Pneumothorax, option D, can cause sudden chest pain and dyspnea, but it is less likely to result in the degree of hypoxia observed in this patient. Question 29. A 25-year-old male presents with a painful, swollen right knee after playing basketball. He has difficulty fully extending the knee. What is the most likely diagnosis? A. Anterior cruciate ligament ankle tear. B. Meniscal tear. C. Patellar dislocation. D. Osteoarthritis. Answer A. Explanation. An anterior cruciate ligament ankle tear is the most likely diagnosis in this case. Ankle injuries are common in athletes, particularly in sports that involve sudden stops and changes in direction like basketball. The inability to fully extend the knee and the pain and swelling are typical findings. Meniscal tears, option B, can also cause knee swelling and difficulty extending the knee, but they are less likely to cause instability or the characteristic mechanism of injury seen in this case. Patellar dislocation, option C, may result in knee pain and difficulty with extension, but it typically presents with a visible deformity or a pop at the time of injury. Osteoarthritis, option D, would be unusual in a young, healthy individual and typically presents with more chronic, non-acute symptoms. Question 30. A 70-year-old woman with a history of osteoarthritis presents with hip pain that worsens with activity and improves with rest. She has a limited range of motion in the hip joint. What is the most likely diagnosis? A. Hip fracture. B. Rheumatoid arthritis. C. Osteoarthritis. D. Vascular necrosis. Answer C. Explanation. Osteoarthritis is the most likely diagnosis. The patient's age, history of osteoarthritis, and symptoms of worsening pain with activity and improvement with rest, along with limited range of motion, are characteristic of hip osteoarthritis. This degenerative joint disease is common in older adults. Hip fractures, option A, typically present with acute pain, especially after trauma, and the patient would likely be bear weight. Rheumatoid arthritis, option B, can affect the hip joint but is more likely to present with symmetrical joint involvement and other systemic symptoms like morning stiffness. Avascular necrosis, option D, can cause hip pain but is usually associated with history of trauma, corticosteroid use, or alcohol use, and it often presents with pain at rest rather than improving with rest.